Haemophilus influenza is a gram-negative coccoid rod which is well known for causing 4 major infections. Can you remember them? Hint, they are all in the word Haemophilus. Okay, so this infection is thankfully very rare now as serotype B that causes it is covered in the vaccine, but let me give you the clinical scenario. And this, by the way, is your classic board question. A 3-year-old child presents to your clinic. Maybe he's from an immigrant family and doesn't have a vaccination history. He looks pretty sick. I mean, he's leaning forward, sticking his chin out, and it looks like he's having trouble swallowing his own saliva. What? Why? He's drooling. You get close to him and what do you hear? You hear some seriously noisy breathing. Stridor. Inspiratory stridor is a high-pitched wheezing sound that is indicative of upper airway obstruction. Drooling, stridor, and toxic appearance in a child are bad signs, folks. This kiddo's airway is in some serious danger. Okay, so what is our diagnosis? Epiglottitis. You hear a lot about the imaging findings in epiglottitis. And what is the classic finding? The thumb sign. Here you can see a very edematous epiglottis. You see how large that looks. Normally, it appears much thinner. Okay, so to recap, suspect Haemophilus B infections in children who are immunocompromised, non-vaccinated, immigrants, or asplenic. The way this can be asked is through a description of a child from another country who's in respiratory distress, experiencing dyspnea, dysphagia, and drooling. These are symptoms of epiglottitis. Suspect Haemophilus influenza in such a patient. All right, what is the next disease H. flu can cause? Meningitis. Excellent. We already talked about the signs and symptoms of meningitis on the previous slide, so I won't belabor them again, but like epiglottitis, meningitis isn't really seen with H. flu anymore thanks to the HIB vaccine. Do you remember which bacteria we already talked about that is currently the leading cause of otitis media? Strep pneumo. Well, another common cause is H. flu. And finally, pneumonia. This is also a common consequence of H. flu infection. Legionella pneumophila is very difficult to visualize because it is poorly gram-stained and requires a special silver stain to be seen. It requires a very specific growth medium, charcoal yeast. Charcoal yeast. This extract culture that also has iron and cysteine added. If you see these conditions mentioned, it's a clue for Legionella. So if you envision a Legionnaire sitting around a campfire holding an iron dagger or maybe even ironing a shirt, then you'll remember the special media for Legionella. Legionella pneumophila, the bacterium responsible for Legionnaire's disease, is so named after its discovery at an American Legion convention that was held at a hotel in Philadelphia in the year 1976. At the Legionnaire's convention, the organism was isolated from the air conditioning system, and it was understood that the microbe prefers to inhabit natural and artificial sources of water. Transmission occurs via inhalation of infectious aerosols. The mild form of legionellosis is called Pontiac fever and presents with influenza-like symptoms such as fever, chills, myalgia, generally resolves within about a week without any treatment. Legionnaire's disease is a more severe community-acquired pneumonia presenting with high fever, non-productive cough, headache, and a rapid deterioration to death without treatment. Now, one question. What is the classic electrolyte abnormality that is always given to you on your exam? Hyponatremia. What is pretty characteristic about this type of pneumonia is that it will also often present with diarrhea. Since Legionella is an atypical bacteria, Legionnaire's disease should be treated with azithromycin plus a fluoroquinolone such as levofloxacin, as the microbe contains beta-lactamases which make it resistant to penicillins. Okay, flash quiz. A 27-year-old female presents to her physician complaining of dysuria and dyspareunia. A pelvic exam is performed and gram stain shows multiple PMNs with gram-negative diplococci. What is the most likely pathogen? So, what we're describing here is a gonorrhea infection, which, remember, can oftentimes be asymptomatic. This young lady has developed pain with urination and pain with sexual activity. The physician does the correct thing by taking a gram stain and hopefully culture of the cervix, which reveals gram-negative diplococci. This is characteristic appearance of Neisseria gonorrhea. Pseudomonas aeruginosa is a gram-negative rod that is oxidase positive. Oxidase positive. It can be immediately identified in the lab because it has a characteristic odor and color. The color is blue-green due to Pseudomonas producing the pigment piocyanin, and the smell is sweet, grape-like, or fruity. Remember these characteristic colors and odors because they are giveaway clues unique to Pseudomonas, and you will see them on your boards. Pseudomonas is a natural soil contaminant commonly found in moist environments, which can enter the hospital when guests bring in plants and flowers. Pseudomonas aeruginosa normally does not infect healthy hosts, but you should worry about it in immunocompromised hospital patients who are burn victims or medically instrumented with catheters or endotracheal tubes. So, what are some of the common diseases caused by Pseudomonas? Just like H-flu, we can use the word Pseudomonas to help us remember. Ventilator-associated pneumonia is a common complication of long-term ventilation. When patients develop fever after being on a vent for a while, you should always get a chest x-ray to rule out pneumonia, as well as getting a culture of the endotracheal aspirates to see if you can speciate a bug. And what genetic disorder also predisposes to increased risk of Pseudomonas? Cystic fibrosis. Hang on, quick little genetics integration coming. What chromosome is mutated in CF? Chromosome 7. Can you remember the name of the gene? Well, it's CFTR. Hang on, why did I write it like that? Oh, the 7 and the F are awfully similar. So CFTR, chromosome 7, now you won't forget it. And what does the gene do? It's a chloride channel. Okay, great. So what is the diagnostic test of choice? The chloride sweat test. These kiddos will have faulty chloride channels on their skin, so they're actually going to have high concentrations of chloride in their sweat, which you can detect on a sweat test. Excellent. Pseudomonas is particularly good at forming biofilms, so this is a key virulence factor in the progression of the disease. Pseudomonas can cause sepsis in populations with neutropenia, diabetes, extensive burns, or leukemia. The characteristic lesion is called ecthyma gangrenosum, which has a black necrotic center with a raised hemorrhagic ring. It is a rapidly progressive necrotic lesion that usually occurs in immunocompromised hosts. Otitis externa is commonly caused by Pseudomonas. In diabetics, it can cause malignant otitis externa. What is the key physical exam finding in otitis externa? That's going to be pain with manipulation of the pinna. The pinna of the ear is this part of the ear. And you usually see a white exudate in the external canal. These infections can spread to the mastoid bone and even intracranially if not treated. By the way, what cranial nerve would you expect to be affected if this was the case? Cranial nerve 7, the facial nerve. Pseudomonas is also a cause of urinary tract infections, UTIs. Though again, consider the more common causes of UTI in the healthy population. But in those that have a chronic indwelling Foley catheter, or people who have spent a lot of time in the hospital, you might want to consider Pseudomonas. And remember that diabetics and drug users can get Pseudomonas osteomyelitis. Finally, Pseudomonas can cause infection of the skin hair follicles, a condition known as hot tub folliculitis because it often is seen in people who sit in warm, contaminated water of hot tubs. We discussed the virulence factors in the basic microbiology lecture, but remember, exotoxin A inhibits elongation factor 2 to disrupt protein synthesis in human cells. Hey, by the way, do you remember which other organism can inhibit EF2? The answer is Corynebacterium diphtheriae. And what was the mechanism? That was via ADP ribosylation. Endotoxin is an important cause of pseudomonal sepsis. Pseudomonas also contains many enzymes such as elastase and alkaline protease, which can disrupt connective tissue and allow for easy spread of the organism. Finally, Pseudomonas is resistant to many antibiotics, and therefore antimicrobial therapy should be chosen wisely. It is usually a combination of an aminoglycoside, such as gentamicin, and an extended spectrum penicillin, such as piperacillin. Okay, time for another flash quiz. This one is a clinical vignette. A 56-year-old man presents with a couple days of non-productive cough. He also has some fever and headache. No real past medical history, but he does mention that he recently returned from a cruise. Okay, he came back from a cruise. Vital signs. Pretty high fever, 102 degrees. That's high. He's tachycardic, but he's normotensive. O2 sat looks okay at 96%. You get a basic set of labs and your chest x-ray is pending. Okay, so your Chem 7, anything look abnormal here? I'm going to say that sodium of 130 is a little bit low, but the remainder actually looks okay. How about your CBC? Your white count is a little bit elevated at 18. Your hemoglobin and hematocrit look okay. So what is your diagnosis? Questions like this can be tough, so let's talk about how to answer this. Essentially, the question is asking you what infection, you can tell because his white count is elevated, causes fever and cough and hyponatremia. Your answer, Legionella. Remember, the electrolyte abnormality that is unique to Legionella is hyponatremia. E. coli is a lactose-fermenting gram-negative rod that is normally part of our gut flora. Various virulence properties of E. coli are responsible for the wide range of diseases that it can cause. Fimbria, also known as pili, on the E. coli allow it to attach to the urinary tract epithelial cells, causing UTIs, cystitis, and if it ascends, pyelonephritis. Without these fimbria, normal urination would just sweep the bacteria away. E. coli's capsule is an important virulence factor in its ability to cause neonatal meningitis. As we've already discussed, the LPS endotoxin is responsible for septic shock, as in most gram-negatives. EIEC stands for enteroinvasive E. coli. It does not produce a toxin, but the microbe causes necrosis and inflammation of the intestinal mucosa. This generally presents as dysentery similar to disease caused by Shigella. ETEC, or enterotoxigenic E. coli, produces heat labile toxin, which stimulates adenylyl cyclase to produce cyclic AMP. It also produces heat stable toxin, which induces guanylyl cyclase to produce cyclic GMP. Remember the mnemonic from the micro lecture. Stable on the ground, labile in the air. This kind of E. coli is a common cause of traveler's diarrhea. You might have even experienced this one for yourself. Some abdominal pain, watery, non-bloody diarrhea, and it's generally self-limiting, usually resolves within a few days. Remember that the heat labile toxin is similar to the cholera toxin, while the heat stable toxin is similar to the Yersinia enterocolitica toxin. EPEC, or enteropathogenic E. coli, rarely can produce a Shiga-like toxin, but often does not produce any toxin at all. Instead, its mechanism of pathogenesis is that it adheres to the intestinal mucosa. So here's our intestinal mucosa, here's our adherent EPEC. Now, it causes effacement or flattening of the villi and also causes inflammation, both of which decrease absorption and cause diarrhea, especially in children. Remember, P for pediatrics. EHEC, or enterohemorrhagic E. coli, of which O157H7 is the most common serotype, also produces a Shiga-like toxin. It causes swelling of the endothelium and narrowing of blood vessels. Do you remember what the Shiga toxin does? It inactivates the 60S ribosome subunit inhibiting protein synthesis. This is what causes the hemolysis and platelet consumption, as well as reduced renal blood flow, and it leads ultimately to hemolytic uremic syndrome, or HUS. And what was the classic triad of HUS? Remember, anemia, thrombocytopenia, and acute renal failure. When you learn about thrombotic thrombocytopenic purpura in hematology, compare the symptoms of that disease to HUS, since they're very similar. EHEC can be differentiated from other E. coli by its inability to ferment sorbitol. Another lactose-fermenting gram-negative bacteria, Klebsiella, is urease positive and causes lobar pneumonia that is often severe and necrotizing. I like to remember the key facts about Klebsiella with the mnemonic Klebsiella. Okay, so think about someone opening their mouth and saying, ah. Oh, that's a little scary. Okay, maybe they'll make that go away. So I like to open mouth because that helps me remember the first A, which is aspiration. And what class of people are at a really high risk for aspiration? Starts with an A, alcoholics, you got it. Alcoholics have depressed levels of consciousness and can aspirate vomitus or even oral secretions. Diabetics are also prone to Klebsiella infections. What can happen in the lung if someone aspirates vomitus? They might develop an abscess. You can see the air fluid levels here on axial CT of the chest. There are also some pleural effusions bilaterally, which you can see here in the dependent areas of the lung. Can you remember the buzzword that is commonly used to describe the appearance of sputum in Klebsiella pneumonia? Red currant jelly sputum is the classic description, so you might see it described as mucoid or red appearing. Here's some fresh currants to help you remember. Campylobacter is one of our 2 comma or S-shaped organisms. And what is special about the growing temperature? Remember the mnemonic that Campylobacter likes the hot campfire because it grows at 42 degrees Celsius. You should remember that it is a common cause of bloody diarrhea when acquired from undercooked chicken and unpasteurized milk. Also, remember that Campylobacter is one infection that is believed to be responsible for triggering an autoimmune peripheral neuropathy known as Guillain-Barré syndrome. Do you remember what type of paralysis is classic in GBS? I hope you're thinking ascending paralysis. If not, don't worry, this will be covered in depth in the neurology chapter.